Hello everyone. Today I will be continuing with my last video, and I had stopped at the level of the non-nodal tissue. Today I will be discussing the action potential in the nodal tissue of the heart. And there are two types of nodal tissues in the heart. One is the SA node, also called as the sinoatrial node, and the other one is AV node, that is the atrioventricular node. Now, in these nodal tissues, the important difference is that there are no sodium currents. The sodium channels are insignificant, and since they are insignificant, that rapid upstroke of the phase zero depolarization is not seen. So what we see is whatever only this depolarization, it is contributed by the calcium currents. So in nodal tissue you will see action potential somewhat like this, and in this phase there will be entry of calcium ions. Now calcium is a positive ion, it will lead to depolarization, and after they go into inactivation, there is opening of the potassium channels and there is efflux of potassium. So this is an action potential that you see in the nodal tissue. Now this, I will tell you a very important point regarding the slope of this depolarization curve. Okay, the steeper this slope is, steep means just like you see in a Purkinje fiber or in the ventricular muscle. A steep slope means the rate of conduction will also be faster, and when the slope is not very steep, the rate of conduction is also slower. So the nodal tissues, they conduct at a very slow rate. The SA node is the pacemaker of the heart. The AV node has to conduct impulses from the atria to the ventricles, and since it has got this type of action potential, the conduction velocity across the AV node is also slow, and since it is slow, it is responsible for what we call as a AV nodal delay, which is very important as far as the cardiac physiology is concerned, because the atria, they get time to pump all the blood into the ventricles before the ventricles go into their contraction. Okay, so that AV nodal delay, which is due to this slow, or you can say a less steep curve of the action potential, that is responsible for the slower conduction or the AV delay. Okay, now there are some very important points to be discussed. One very important point is excitability. Excitability means how easily a cell can be excited into an action potential. So you know there are two things we were discussing. One is a resting membrane potential and second is a threshold potential. Now the lesser the gap between these two, the lesser the gap between the resting membrane potential and the threshold potential, it will be easier to reach the threshold, and when you reach the threshold, an action potential will ensue. So the tissues which have a resting membrane potential approaching the threshold, they will be more excitable. Okay, and then second thing is another important concept is that of refractory periods. So what is refractoriness? Refractoriness is the inability of a myocyte or cell to respond to another stimulus when it is already in an action potential. Okay, so usually it depends on the state of inactivation or openness or closeness of sodium or calcium channels, whatever are concerned with the action potential. Now you know in the non-nodal tissues, it is the sodium currents which are responsible for depolarization. So, and you also know that the sodium channels, they go into inactivation soon after a lot of sodium has entered into the cell, and how they get reactivated back into a closed state, that happens, that is dependent on voltage changes. So when in that type of a action potential, this was a phase 0 depolarization, everything coming back. So at this point, all the sodium channels, they had gone into inactivation, and when these sodium channels, they stay inactivated as long as the voltages are high. When the voltage comes back, it approaches the resting membrane potential, the sodium channels, they come back from the state of inactivation. So they are again ready to take another action potential. So that thing coincides somewhere around this, towards the end of action potential. And after this point, the cell, till this point, the cell is totally refractory. You can call it as an absolute refractory period. So if you give a heavy stimulus at this point, there will be no stimulation of that cell, because it is already undergoing an action potential. But beyond this point, a strong stimulus might lead to another action potential. Okay, so that period is called as ERP, or the effective refractory period. And in case of a non-nodal tissue, this ERP is generally a little less than the action potential duration, because the action potential duration is from this point to this point, but ERP is just a little less, just before the cell reaches its resting membrane potential. So this ERP generally in non-nodal tissues is lesser than the action potential duration. Okay, but the case in a nodal tissue is different. In the nodal tissue, the calcium channels are responsible for the depolarization, and these calcium channels, they also go into inactivation at this point. That's why there is no more entry or no more depolarization beyond this point. But the recovery of calcium channels from inactivation, it takes a longer time, and it is independent of the voltage. So these, after a little time period, these will be reactivated, and then they can take up another action potential. So in most of the nodal tissues, the effective refractory period is more than the action potential duration. And the reason I have told you, because the calcium channels, they are not voltage dependent for their reactivation. They need time. So after a particular time has passed, the cell can again take up a new action potential. Okay, so that finishes today's class. Now in next lecture, I will be discussing arrhythmogenesis and antiarrhythmic drugs. Thank you so much.